session was recorded live in San Antonio, Texas for the 2003 CALLERLAB Conference. This is tape number 24, Partner Session.
This is Tuesday, April 15th. Hope you all sent your taxes in. If not, you better find the post office. The 10:45 session for Partners Committee, and we're going to have an introduction to CPR and how to perform CPR, and hands-on with the mannequin ResuciAnnie and the monitors to see that yes, you can do it. Some people just don't want to learn how because they don't think they can know how they can do it, and yes, you can. It's pretty easy once you have the techniques. And our instructor or informer is my husband, Bev Sutter. He's certified in CPR and first aid training, and he's a safety director at fertilizer plant, and he's also a square dance caller.
So fertilizer plant, I'm full of bull. First off, I'd like to say this is, you will not be certified to do CPR after this class. This is just an introduction. Some people have never seen it performed, don't know anything about it, so this is more or less just an introduction to it as to what it is. I encourage you after this class, if you would like to be certified, to attend a Red Cross or American Heart Association CPR course, and they are very good instructors. Most of them are well versed in teaching CPR, and so I just want to make that clear right off the bat. As far as my experience, I've been teaching for the Red Cross for 17 years, and both CPR and first aid. I've been an EMT on our local fire department for 13 years. I am no longer involved with them, but I've ridden on the ambulance quite a bit, and I've performed CPR many times myself. Currently, I'm a first responder certified with the state of Illinois, and I do teach our employees first aid and CPR also. So, give you a little background. I've seen about everything that can be seen as far as CPR, and I've done most of it myself. And probably one of the few instructors that can say that, because unless you ride on an ambulance and do it, the opportunity does not arise very often. So a little bit of my background. First off, I'd like to know how many people here in the audience are certified CPR? Just Bev. That's it. Okay. Yeah, how many were at one time? Put it that way. So there's about 4 hands. So some of you have a little idea what it's about. Has anybody out there ever performed CPR? 2. Okay. Has anybody out there seen CPR performed? Okay. Yeah, there's a few more. Okay, it's about half of you. Okay. How many have witnessed a medical incident at a dance?
I
Sure have. I know you were talking earlier. Yeah. I have also. In fact, we just had one. We put on 2 weekends in Dubuque. We just had an incident in our last, was that February? We had a gentleman, as soon as the tip was over, collapsed. Thank God it was not his heart. He did not pass out. He just collapsed. They had to help him off the floor. We got over to him, got an ambulance coming right away. And he vomited several times. And, of course, they got him to the hospital and found out it wasn't his heart. They don't know what the problem was. It was some kind of intestinal problem. I guess he's had it years before. But they do happen. I've seen a heart attack at a dance once also. And we've been in the business since, about 64. So it doesn't happen often, but it does happen from time to time, especially with the age of the dancer moving upwards.
One that happened to me, she was only 49.
49, a young one. He says he had an incident during coordinate on a dance. She was only 49 years old. So you don't really have to be elderly, I guess is a good point to make out. Okay. What's the signal in a square when something medical emergency happens? Does everyone know? Yes, everybody joins hands, raises hands up, and that lets the caller know that there's a problem. Now, if there's only 2 or 3 squares on the floor, if the caller's worth his salt, he should recognize that right away. But you get into your conventions, and where you have a crowded floor, the caller may not see what's going on. Okay, so it's very important when we're in, especially with a crowded floor, to go ahead, take the initiative, have everybody grab hands, signal, have one person attend the dancer, the most qualified, whoever that may be, and raise the hands, and at that time the caller should stop the music and clear the floor, make sure the emergency help is on the way, and take care of the problem. Okay, let's talk, before we get into the CPR, let's talk a little bit about choking. What's the international sign for choking? Hands at your throat, right? Okay, and that means you have a problem. Okay, and as long as that person is conscious and coughing forcefully, you let him go. Okay, you want to stay with him, let him go. Okay, but it gets to the point where he's not coughing very effectively, then that's when you'd want to help. Be sure you find the navel, get above the navel, put your thumb, make a fist, put your thumb above the navel, the other hand on top, and start with the thrust. And you'll keep doing that till the person either coughs it up or becomes unconscious. Has anyone ever seen anybody choking? Yeah, 3 or 4. Every class I've taught, I always ask that question, and invariably there's always someone that has witnessed a choking incident. And every one of them says the same thing. It has always worked. I have never found anybody yet where they said it has not worked, the Heimlich maneuver. And they all say the same thing, that it spits right across the room. So there's a lot of force there. Above the navel. Okay.
You take your hand and make a fist, and you'll have the thumb next to and above the navel in the midline, straight up and down. And then take the other hand open and push it in. And as you push in, you force the diaphragm to shrink the lungs to force the air out, and that will make the object come out. So you're forcing the air, this in, to move that diaphragm to expel the air and hopefully the object.
Yes, it's a very, very simple maneuver to perform. Doesn't take much practice at all. In fact, maybe later on in the session we'll let you just kind of, yeah. Okay, yeah. We're not actually going to perform it, but the hand position is the most important thing. Yeah, there's another technique. Yeah. Okay. Let's get into if someone collapses at a dance. And there again, I suppose we should be using this microphone. So if you do have a question, Bev will walk around with the microphone. Just introduce yourself and then ask the question. Okay, let's say we're at a dance and someone does collapse. What's the first thing we should do? Okay, if you're in the square, go ahead and raise the hands, have someone attend to the dancer, okay? We're going to say the dancer collapsed and he's not conscious, okay? So the first thing you have to do is check the dancer to see whether he's conscious or not, okay? And the best way to do that is just tap, shout, shake his shoulder. If you know their name, call their name. See if you get any response, okay? This becomes very important if you hadn't just walked into a room and you saw somebody laying there and you don't know if he's maybe a diabetic, had a problem, just passed out. Could be a lot of reasons. So that's why you need to establish to see if that person is responsive. If they're not responsive, then you know they need help. But you don't want to start doing CPR mouth to mouth on someone that's just sleeping it off a little bit or maybe just disoriented for a little bit. So it's very important to get a response from them. Like I say, the best thing to do is grab them on the shoulder, shake them a little bit, call their name, and see if you can get a response. Okay? If you don't get a response, then it requires further action. Okay? And what we're going to have to do is make sure they get on their back, get them on a back on a hard surface. It's hard to perform CPR on a bed because you have the mattress with the cushion effect, and as you compress, it's not going to be very effective. So you do need to get them on a hard surface. But at a square dance hall, we have a lot of acres and acres of hard surfaces, right? So get them on their back. And then we go into what they call the ABCs. It stands for airway, breathing, and circulation. Okay. But before we get into the ABCs, one step prior to that, what the Red Cross teaches is check, call, care. First, you're going to check the scene, make sure everything is okay for you to go. Out on the square dance floor, it shouldn't be any problem. Okay. Call, be sure someone calls the ambulance. Okay, because what happens a lot of times is everybody gets involved with the person and nobody goes and calls the ambulance. The sooner you can get that ambulance and the professional help there, the better off that victim is going to be. So make sure that somebody goes and calls the ambulance. And it's best to point them out, call them by name and say, Bill, you go call an ambulance. Or Sarah, you go call an ambulance. But if you just say, somebody call an ambulance, who's going to go? Right? So it's a good idea. Point out, say, hey, Bill, go call an ambulance. And that way Bill is going to go call an ambulance. But we want to make sure that Bill isn't the doctor in the crowd first, right?
At our event in February, 2 people called. The caller, other than David, we had another caller, Tom Roper. He called the ambulance, and there was a Bill standing next to me, and I told him, call the ambulance. And as I looked up, he was already dialing. So we did have 2 respond to the phone to call on that emergency we had.
Okay, once you have the ambulance coming, do you want to give care to the victim? Well, you're not going to wait. You're going to make sure that somebody goes and calls, and then you're going to give care to the victim. And that's where the ABCs come in, airway, breathing, circulation. The first thing you're going to do is open the airway. And the airway, opening the airway is very simple. I'm taking my left hand, putting it on the forehead. The right hand, I'm using about 3 fingers under the chin, and I'm tilting the head back. Okay? The airway is open. I've witnessed this on my ambulance years experience I've had. There have times when we've responded to incidents, and all we have to do is open the airway and the person starts breathing. So it's very simple. Is somebody going to be breathing if their chin is down into their chest? No. Not if they are, it won't be very well. So opening the airway is very important. So you're just going to tilt that head back. And then you have to check to see if they're breathing. So you have opening the airway, then you check for breathing. Once again, it does no good to check for breathing if the airway isn't open. Okay? Because you're not going to get anything. So you open the airway, check for breathing. I'm going to put my ear near their mouth. I'm going to watch their chest. So I can feel an air exchange, and I'm watching their chest for an up and down movement to give me an indication that they're breathing. Okay? If they're not breathing, I'm going to give them 2 breaths. Do that very simply by pinching the nose and blowing into the mouth, and I'll demonstrate it. If you watch the, let's see, which one is it? This one here, this meter here. I should get it up into the green. Two breaths. After 2 breaths, you're going to check for a pulse. Find the Adam's apple. Go down into the groove of the neck, and you're going to be feeling. You might have to move fingers around a little bit, but you should be able to feel a carotid pulse. Okay? You're going to take about 5 to 10 seconds, because you're not only just seeing if they have a pulse, you're also going to see how strong of a pulse is it. Is it a regular beat, or is it beat once and then wait and then maybe beat twice? So you're looking to see the strength of the pulse, the duration of the pulse, and how regular it is. So you're doing more than just checking for a single pulse. If you find one beat, take your fingers off. That's not going to give you a good indication. So they suggest 5 to 10 seconds. Okay, if he has a pulse, then all you're going to have to do is maintain his airway and do the rescue breathing. Okay, if you don't have the pulse, that's where you have to come in with the CPR or the cardiopulmonary resuscitation. It's a combination of compressions and breaths. What I will be doing is compressing the breastbone 15 times 2 breaths. So,
I see some of you going like this, checking your carotid. Only put pressure on one side at a time. Don't do this trying to look for it, or one on each side trying to look for it. Just do one side or the other, but not both at the same time.
You don't want to grab the victim by the throat. Because if you do this and press, you're going to be cutting off both sides. Okay? So that's why they only suggest one. Using 2 fingers, one side, go down from your Adam's apple. It's kind of hard to do on yourself, but believes you're in somebody else. But to find the landmark about where to compress, find the ribs, the rib cage. And you follow that up until you're on solid bone, okay? Solid breastbone. Leave your 2 fingers on the breastbone, you put your other hand down next to that, and then that's where you do your compressions. One thing is you don't want to press on what they call the xiphoid process. It's that little bony structure right where the 2 rib cages come together. And if you can feel that, it's kind of bouncy. You don't want to press on that. So that's why you need to be up on the solid breastbone, okay? Because if you break this off, you could puncture the liver and give them some more medical problems. So be sure you're on solid breastbone. And you'll notice when I demonstrate that I'll leave my fingers there and I put my hand next to it. One common fault that I've seen with students when they're doing CPR is they'll find their landmark and then they take their hand away. So you need to leave the fingers there, put your other hand next to it, and then you know that you're in the right place. So I'll go through a series of the 15 compressions and 2 breaths. In fact, better yet, what I will do is I'll go through a whole sequence as if somebody had just collapsed and show you what it looks like. Okay, I see the victim collapse. We've given the signal. I've assigned someone to go call an ambulance. I'm going to tap and shout, "Bill, are you okay?" No response. I'm going to open the airway, 2 fingers on the chin, the other hand on the forehead, tilt back, and then I'm going to listen to see if they're breathing. My ear is going to be near his mouth. I'm watching the chest. He's not breathing, so I'm going to pinch the nostrils and give him 2 breaths. Okay, now I'm going to check for a pulse. 2 fingers on the Adam's apple, go down to the side of the neck, and I'm going to feel about 5 to 10 seconds, see if he has a pulse. Okay. If no pulse, then I'm going to start the CPR. I'm going to find the rib cage. I'm going to go up until I've on the solid breastbone, put my other palm next to the fingers. I'm going to keep my elbows straight, and I'm going to compress 15 times. Then I'm going to give 2 breaths. And I'm going to do 4 cycles of that. Then I'm going to check the pulse again. And you will keep on doing that until help arrives. Or if you're by yourself, you're too tired to continue. Then you don't have any choice. It's like I say, it's really not that difficult to do. In fact, it's easier to do, I think, my experience, it's easier to do it on a human being than it is on this mannequin. It's not very flexible. You don't get a good seal with this. But it's not that difficult. And invariably, I would probably guess that there's probably been somebody there that's no CPR, that can help get into the 2-man. So you won't have to do it all by yourself, but it does take a lot out of you, especially if you're doing the compressions and giving the breaths. It's very tiring, and it doesn't take you long. Besides that, you're going to be excited. And I don't know about you, but when I get excited, I get out of breath and tire very easily. I've learned to control it through the years on the fire department and things, but it gets the adrenaline pumping. You'll find out you're going to wear out a lot easier than a normal situation. So, what we'll do, does anybody have any questions up to this point?
Gene Record from Kentucky. I just want to make sure that you say you do that 4 times?
4 cycles.
4 cycles of the pushing and
the breaths. 15 compressions, 2 breaths. Even
if you don't check it each time. You just automatically go on and do 4 times.
Right. Now, if you have somebody standing by, you can have them monitor the pulse for you. Okay. Because actually, when you're doing the compressions, they should be able to feel a pulse. Mm-hmm. But while they're giving the breaths, you could have somebody stand by to see if they're getting a pulse.
And if you get a pulse?
And if you get a pulse, you'd stop and just maintain the airway. Okay? Maybe his heart started beating, but he may not be breathing on his own yet, so you'd want to maintain the airway and check the breathing. If he's not breathing, then you'd have to do the rescue breathing for him. Okay. Yeah. In fact, the gentleman that collapsed at our dance back in February there, he was conscious. He was sitting up. He was pale as a ghost and very sick. And I could not get a radial pulse on him, which is down on the wrist. I could not get it. And there are several other people tried too. He did not have a pulse in his wrist. The ambulance, they were there in about 5 minutes. Yeah, they were close, and they got the call, and they were there in about 5 minutes.
They sent 2 ambulances, a fire truck, and a police car. Yeah, they always do it, so that we have plenty of help.
But he was back dancing. This happened on a Friday night. I think it was the first tip, wasn't it? First tip Friday night. He was back dancing with us Saturday night, so they just kept him overnight and figured out it wasn't anything serious, and he was back dancing with us. Looked good. He didn't look worth the darn when he left Friday night. But it was very, very fortunate that it wasn't anything serious. Any other questions?
Mary McCravey from St. Louis area. Does the fire truck always come when you call the ambulance?
It depends on the departments. A lot of times, if they have a pretty well-staffed ambulance, they may not require it, but a lot of times they will need help, especially on the location of the victim. If he's up on the 2nd floor and they have to carry him down steps or things like that, sometimes it's a little much for 2 people to handle, so they will automatically dispatch a truck with the ambulance just for the extra manpower.
And they have first responder training, which would help you until the ambulance guys got there.
Yes, they wouldn't have as much training as the paramedics, but they probably know enough that they could really help. Just run out to the ambulance and get some equipment for them, be helpful for them.
Crowd control, anything like that.
I'm Uda McCrae from St. Louis. We live in a retirement home, and we have calls quite frequently, and I look out of the window and always see an ambulance. So in our area, an ambulance and a fire truck come always at the same time.
I think probably most departments, I don't know for sure, this is just my guess, but I think most departments, it's probably a standard operating procedure that when an ambulance is dispatched on a heart attack call that they do have a fire truck, just like I say, for the extra manpower.
Also, your fire truck is located in a certain district. Your ambulance could be anywhere in the city. So, depends on how many ambulance forces you do have.
Jean Farrell, Murphy's. What about people who carry nitroglycerin?
Okay.
And you know that person has the nitroglycerin and is subject to heart attacks?
Now, is the person conscious or unconscious?
Let's say he's unconscious.
He's unconscious? I don't think the nitroglycerin is going to help him that much at that point, and I think you're better off attending to him as far as getting his airway and checking to see if he has a pulse. If he is conscious and just having a chest pain, it'd be perfectly okay to help him take his medication. Maybe he just can't move,
can't get to it.
Can't get to it, he doesn't have it on him or what. It's perfectly fine to help him take his nitroglycerin. But once he's unconscious, I think he's beyond the point where the nitroglycerin is really going to help him. If you do get him to become conscious, then I'd certainly give it to him. But.
I'm Janet Oliveri from North Glen, Colorado. Just a comment, when we were being certified, we were told, don't say call 911, don't say call the ambulance. You have to be very specific and say call 911, because if you're really shook up, somebody's going to be looking for an 11 on the phone.
That's a very good point.
It sounds funny, but it's true.
Like I say, once your adrenaline gets going, you're not really thinking real clear. There's other important things. It seems like it overtakes your natural thought process, and you get excited, and it takes a little more effort to put your thoughts together.
Jean Farrell Murphy, I have seen it happen where the victim who is conscious doesn't want the ambulance to come, doesn't want 911 called. And where I saw this happen, we were in a resort in Mesa, Arizona, and it got explained by someone to those present that there's no cost when the ambulance comes. The cost begins when the ambulance takes you somewhere. But you should never resist, if you're in trouble, having the ambulance called.
Right. I believe that's a good way to put it. As far as I know when we were on the ambulance, when we got called, there is no charge. In fact, even they have already called us en route and said, we do not need the ambulance, you can turn around and go back. We've done that already too. But it's better, in your judgment, if you think that ambulance needs to be called, to go ahead and call it and let the ambulance personnel deal with it.
I'm Carrie Mallard from Saskatoon. Actually, we were told quite definitely that you should never, if something happens in your home, you should never, and the person does not want you to call an ambulance, well, you should never drive them to the hospital. You should always call an ambulance. That's correct, because situations have a tendency to get worse. And if you're driving down the road and that situation gets worse, you've got big problems. You're going to have to pull over and call an ambulance anyway. So yes, a lot of the time those people, some of those people, and I've witnessed this myself, they're in denial they're having a heart attack. In fact, I just read an article not too long ago where they found this gentleman dead in bed the next morning, had a packet of Rolaids on his nightstand. He had taken about a half pack of Rolaids thinking he had indigestion. And the ironic part of that whole story was this guy was a heart surgeon. So a good rule of thumb on that, if you're having indigestion or having pain, if it lasts more than 10 minutes, 5 or 10 minutes, they could have a problem. In fact, we had a deal with Bev's sister here a few years back. She was just a young gal in her late 20s, and she was having chest pain. And I said, if it lasts more than 5 or 10 minutes, I says, we're going to call an ambulance. And in the meantime, we had given her some 7-Up, and the 7-Up took care of the problem. It was just indigestion. But if it lasts longer than, like I say, in 5 to 10 minutes, and they're still having the chest pain, you're better off to take them and get them checked out. If it's somebody that's had a history of heart trouble, you don't wait 5 or 10 minutes. You call right now, okay? And even if it is indigestion, you let them figure that out at the hospital. But somebody, like I say, that's never had a history of heart trouble and only in their 20s and they're having a little pain, you can wait 5 or 10 minutes, but I wouldn't suggest waiting longer than that. Anybody else?
Wendy Wilcox from Georgetown, Ontario. I had a heart attack 2 years ago, and I had a pain. It was kind of a funny little pain right here. I felt fine. Everything was fine. I did go to the hospital, and they checked me out for gallbladder, and they wanted to take some pictures and what have you. They told me to come back the next day, and I happened to mention to them that my blood pressure seemed higher than normal, and they said, well, that happens when you come in the hospital. And I said, not with me. And so they said, well, we'll do an EEG just in case. And 5 minutes later, they came flying in the place with all kinds of stuff and gave me medication and what have you. Said, we think you're having a heart attack. But because you don't fit the bill, you're not overweight, the right age, or whatever, hospitals, unless you tell them what's going on, and I have no history in the family or anything, you got to really say what you're really feeling, because they were going to send me home. And, I was fine, but, you never know.
That's right. That's right. It's better to be safe than sorry when you're dealing with something like that. When you're having heart problems or chest pains, you better get it figured out. And don't linger with it. Like I say, 5 to 10 minutes. And if it does not go away, you're better off going and get it checked out.
More women die of heart attacks because nobody will believe them. It's not the profile that a woman should have a heart attack. Women don't have as many as men do. Well, a lot of women die of heart attack because they weren't checked because they were a woman. And it has nothing to do with the feminist thing. It just happens to be that, that our symptoms are different. I thought I was having a heart attack. It was stress, but it sure felt, but everything I had was on my right side. I had pain on my right side. I had tingling in my shoulder. My fingers were numb, and it was on my right side. Part of it was gallbladder, which I didn't know at the time, but most of it was stress because we had something really big going on that weekend that we've been planning for years. But they took me in, checked it all out. I went home, fine, but at least they checked.
And sometimes even when they do check, they miss it, just like she was saying, but at least you did your part and went in. Okay, any other questions? Okay, what we do is I set the mannequin up here, and if you would like to come up and practice that, I've got 10 mouthpieces with me, so we can have, I've already used this one, so I have 9 left, so if there's 9 of you that would like to try this,
and I'll give you some pointers. Once again, I want to say that this is not a certification class. This is just an introduction class to CPR, and I do request that if you are interested in learning CPR, that you go to your local Red Cross or to the American Heart Association for the training.
American Heart and Red Cross don't always agree on technique, but they all agree on the process. Get help. Do this, do that. So I don't know which one of them, and it may be even hearsay that I had heard that they said they don't want you to do the breaths anymore. Well, that's ridiculous. I hope that was right. Exactly. Yeah. Well, I think mostly it was for people that are afraid to even do that much, and you don't have protection. Anything you can use as a barrier, the napkin even, that you can still breathe through and breathe out. It's a protection from the transmitted diseases that you might get. If you can get a barrier, piece of shirt, something, it will help. Might not work completely, but it will help.
There are many masks that you can get on the market today that are very cheap and inexpensive. You can carry them in your purse. I carry a kit in my car that has a device that you can insert into the mouth, and so you don't have to have the physical contact because of all the diseases that are out there with the hepatitis and the AIDS and everything. You know, people have second thoughts about making contact mouth to mouth with a stranger.
If you get a sandwich bag, Ziploc sandwich bag, in there you can carry a pair of plastic gloves, or try not to get the latex, because if you aren't allergic to it, the patient may be, but just get a pair of gloves, piece of gauze to hold down for pressure, and it folds up to a piece about 2 inches by 2 inches. You keep unfolding it, and it's all plastic, so it will cover almost all the face except for a quarter, half inch, something like this, just enough to get on their mouth and between you and them to breathe through. You know, that's all you need to carry in your car or in your purse. It's just gloves and gauze and this mouthpiece thing.
Another device that's on the market today that's becoming more popular also is the AED, which is the automatic external defibrillators. They're very simple to use. I'm also qualified to use those. We've got one out at our place of employment. And all it basically is hooking up a patch, 2 patches on the victim, and hooking the cord into the defibrillator. You press a button, and it walks you right through it. It tells you what to do, when not to touch, when to press the button to give them the shock. And, of course, we have to requalify that on every year. But they're very, very simple to use. A lot of your airlines are carrying them.
They're all over O'Hare Airport. Yeah. Just look on a wall. You'll see one station
They also have them any place, sporting arenas, any place where there are large crowds of people. The AEDs are becoming very popular because if the person heart is in a fibrillation and you need to get it out, it has to be done within 4 to 6 minutes. So you don't have a lot of time. And
it gives you instructions from the minute of pulling the tags out, putting them on, plugging it in, and then it tells you, you know, it reads to you what it's okay, it's not. Hit the button, we're ready to go. It's kind of like a PhD. Push here, dummy. I mean, it tells you everything. Well, I have a camera like that. You just, push here. So.
Okay, so if there's no other questions, we'll go ahead and let anyone like to try to come up and do this.
Come on up. Make a line. In fact, if you want to come up and watch at the same time, one more question, Roy. I'll be right there. Hang on.
One more question. I have to admit, my mind kind of wandered there for a second. I'm not sure if it was asked. If you have the option of the defibrillator versus your standard CPR, which direction are you going to go?
You go with the defibrillator.
And if it doesn't work, do you then proceed with CPR?
Then you proceed with the CPR, okay. Yes.
Now that we have the demonstrating part of it done, we're going to shut the tape off and do people trying this and other people watching it. So there really isn't anything to put on the tape. Thank you very much.